So which do we want? Patterns of health or patterns of illness? Because they're simultaneously taking place at all times. You want to ride your bicycle, you want to do Stairmaster, you want to do some sit-ups, you want to do stretching exercises, aerobics, Pilates, whatever. Okay, that's all fine. Those are contributing to your patterns of health. You want to get adjusted? Great. Contributing to your patterns of health. You're trying to keep up with the patterns of illness and injury that are besetting you on all sides since the day you were born. Here's how the evolutionary process works in us mammals. Patterns of health. Every 5 days, the endothelium of your alimentary canal has new cells. Every 5 days, your gut lining, right? Every 2 weeks, many of your skin cells are replaced. The liver cells are slower. Every year, you get a new liver. Your red cells in your blood only live 120 days, and then they're all new. Skeleton takes longer, 10 years. Viscera, your internal organs, are replaced after 15 years. So what persists? What persists is you. Each one of these defects in these physical structures of your body, the new cells are remodeling it in exactly that same pattern, whether it's distorted or whether it's perfection. The new cells are replacing that pattern that you have at any moment in time. Patterns of health. So this is Bruce Lipton, and those are two citations, your note number 45 and 46 for that idea. Okay, so all these people are saying, there's no pinched nerves. Give me a break. Oh yeah? There's no pinched nerves. Then what is carpal tunnel syndrome? Now, first of all, I have to say right off the bat that the majority of, first of all, carpal tunnel is actually very rare. It's when the median nerve becomes compressed within the carpal bones, right? That's real carpal tunnel syndrome, right? But all these people coming in and they have it in both hands. That ain't carpal tunnel syndrome. That's cervical brachial syndrome, okay? I mean, that would be such a coincidence. Okay, but whatever. I digress. The point is, carpal tunnel syndrome is an authentic example of nerves being pinched by bones, okay? Cervical brachial syndrome, the radiating pain down the arm, sometimes both sides, okay? That's bones out of place, pinching nerves, okay? Anybody ever have a patient with radiating sciatic neuritis from the lumbar plexus down to the foot?
Yes.
Okay. Bones out of place, pinching nerves, right? What about muscle atrophy secondary to a spinal injury? Has anybody ever seen that? Okay, so there are abundant examples of bones out of place, pinching nerves in a chronic fashion, causing these maladies. What about BJ? The first 20 years of chiropractic, all he did was C1 and C2, HIO for the first 20 years, and he had some sensational results. There's no pinched nerves. Anybody know what NUCA is? Remember that? Okay. Canada, people have waiting list practices in Western Canada. NUCA is very big in Canada, and that's all they work with. Bones out of place, pinching nerves, right? What about Don Harrison and Chris Mertz and biophysics? You know, pre and post x-rays, bones out of place. And here's my favorite, well, not really. Do you think Christopher Reeves knows anything about bones out of place, pinching nerves? Paralyzed for life from C2 down. So there are just example after example. So when you hear people say these uninformed simian phrases like, there's no such thing as pinched nerves, chiropractic cannot affect bones out of place pinching nerves, that's ridiculous. These people, they need to get out more. Compression, neural degeneration. Okay, this is from Alf Brigg. This is classical, right? In the military neck, loss of cervical lordosis eventually causes a fibrosis of the posterior longitudinal ligament, which is in contact with the anterior spinal cord, right? It doubles the pressure on the anterior cord, causing eventual ischemia. This is your note number 11 and 12. This is Kaye, Brigg, and Kapanji. You know, everybody knows this, right? So this is what really will disturb people who are in this narrow mindset, this very narrow, uninformed mindset, especially the educators in the chiropractic profession, when you start talking about the autonomic nervous system. No, no, no. Adjustments may have some temporary effect on the facet joints alone, but don't be talking about diseases, especially autonomic conditions. Well, wait a minute. Let's talk about, just for a second here, how many disease conditions are normal adaptations to abnormal stressors? The one that's really obvious right off the bat is kids with a cold. Kids have flu symptoms, right? So the eyes water, the nose runs, they're coughing and sneezing, okay? Now, they are trained by TV advertising, medical conditioning rather, that the symptoms that they're experiencing are the disease which need to be treated and cured. Oh, we need Robitussin, we need Dimetab, we need all these over-the-counter medicines in order to cure these cleansing mechanisms that show that the child has a functioning immune system. That's actually good. You're giving the kid all that ice cream and all those donuts and all those, you know, chicken McNuggets and all that stuff. You overloaded that kid's ability to process all that trash, right? So that's the body's expulsive immune system. Those are techniques that the body has for ridding itself of poison. So all those diseases that you're talking about in this case are normal adaptations to abnormal stressors. They're good. Those diseases are good. It's a sign that you're still alive. It's the sign that your immune system is active and working.